So shall we start?
Yes, ma'am.
Yes. Good afternoon all. Namaste. On behalf of SageAdvice, I would like to extend a very warm welcome to each one of you. We believe that our topic today on anxiety and depression is a relevant and an important part of our mental health. Similarly, I'm curious and would like to know from each one of you, what made each one of you choose to attend this webinar? There are a host of webinars on different topics, yet you choose to be here today, and thank you for that. So as we continue with our webinar, I would like you all to write your responses in the chat box, and we go ahead with this webinar. In the meanwhile, let me tell you a little more about us. SageAdvice is an online portal which offers an array of services ranging from professional counseling, career guidance, and wellness and life coaching, among other things. We have a dedicated team of qualified experts to help navigate through life situations in a confidential, non-judgmental, and a safe space. This year, the theme for World Mental Health Day, which is observed on 10th October every year, is mental health for all. And this is exactly what SageAdvice strives to achieve. I would like to introduce the team which would be presenting the webinar today. I'll begin with myself. I'm Sharna's Doctor, Chief Counselor at SageAdvice. I'm an MA in Medical and Psychiatric Social Work from TISS, a practicing psychotherapist for close to 30 years, and a certified life coach and a cognitive hypnotherapist. Himani Soni is an MSc in Counseling Psychology, a certified CBT and an REBT practitioner, as well as a registered clinical hypnotherapist. Amina Natalwala is an MSc in Counseling Psychologist and a certified CBT and an REBT practitioner. Let us now take a very quick look as to why mental health is suddenly in focus, especially in times of this pandemic. Our mental health is important as it affects how we think, feel, and act as we face life. It also helps determine how we handle stress, relate to others, and make decisions. It is important at every stage of life, from childhood to adolescence, through adulthood and old age. Your mental health can also affect your physical health by increasing the risk of physical health problems such as strokes, type 2 diabetes, cardiovascular diseases, allergies, among other ailments. The past year of 2020, as well as the current year, due to the pandemic, has been tough on each and every one of us in various ways. The fear and uncertainty of the future, constant bombardment of negative news, loss in some form or the other, be it that of a loved one or someone known to us, loss of jobs, relationships, social contacts, various things, has substantially increased our levels of stress and anxiety, and this has been validated by statistics. If we look at numbers, as per World Health Organization, globally, more than 264 million people of all ages suffer from depression. From that, about 56 million of them are Indians. Another 38 million suffer from anxiety disorders, which makes it approximately 1 in 7 Indians suffering from anxiety. India alone accounts for 36.6% of suicides globally. These figures indicate the widespread incidence of mental health issues. It also shows that when it comes to physical health, people are very conscious and aware these days. from the latest diet trends on or superfoods or various workouts, other things that they can improve their immunity, etc. But when it comes to mental health, the awareness just isn't there. So many people aren't even aware that they may be suffering from some form of mental health issues or may continue suffering in silence due to the stigma attached to this. And it is towards these aims of destigmatizing mental health issues and understanding our mental health better that we go ahead with our webinar today on decoding anxiety.
ನಿನಗೆ ಪ್ರೂಫ್ ನಿನಗೆ ಕಾಂಪಿಟೇಟಿವ್ ನಾಲೆಡ್ಜ್ ಗ್ರೇಟರ್ ಅಂತ ಹೇಳ್ಕೊಳ್ಳೋದು ಎಲ್ಲಾ ವಿಚಾರದಲ್ಲಿ ಕೆಲವು ವಿಚಾರದಲ್ಲಿ
Can you please mute Sandhya?
Thank you.
Yeah, thank you. And so we go ahead with our webinar today on decoding anxiety and depression. And Amina, over to you with the presentation.
Thank you, ma'am. Thank you so much for a wonderful introduction. So I think these days we have heard the word mental health a lot, and this word has just cropping up in our social media and everywhere around us. So we thought we'll talk about it before we go ahead talking about depression and anxiety. So a lot of people associate mental health with mental illness. So they feel that a lack of mental illness means that you're mentally healthy. So basically, if you don't have any mental health issues, basically mentally healthy. However, that is not true. Like just a lack of disease does not mean a healthy body. Similarly, a lack of mental issue does not necessarily mean a healthy mind. So the concept of mental health is more comprehensive. It's more about overall well-being. So it encompasses various number of things, such as your ability to realize your full potential, your ability to cope with the daily stresses of life, such as entering a new relationship or a loss of a job or a loss of a loved one. And it also encompasses your ability to contribute towards the society. So it's about overall well-being rather than just a lack of illness. And just how in physical health, as ma'am said, everybody is able to keep up with it by following a proper diet, by regular exercises. So basically, to make your body fit, you need to work towards it every day. Similarly, to keep your mind fit, you need to work towards it every day as well. And it needs a lot of work. So it's not just a one-time thing. It's not just like you go one time to therapy and you're done, you're mentally healthy from today. So just like your physical health, your mental health will also require your constant attention and contribution from your end. So I'll give it over to Himani now, who will explain why we chose depression and anxiety amongst the huge umbrella of mental health. Over to you, Himani.
All right. Thank you so much, Amina. So yes, again, a very warm welcome to each one of you who have joined us today. So all of you must be thinking, right, there are so many issues going on these days. Then why only these two topics, like called depression and anxiety? Like, why are we focusing on this two, only this particular two topics? So I'll tell you the purpose behind selecting this particular topic of depression and anxiety. That the main reason to go with this is that, it's very important for all of us to understand as well as educate ourselves that what exactly these two terms means. Because a lot of time it happens that, we see somebody going through something, like somebody's going through sadness or somebody's very tense, and we'll keep them like, are you going through depression? I think you have a depression, and we'll keep on labeling them, or we keep on labeling ourselves. So the main purpose is to educate ourselves as well as to others. So that is the main reason we have chosen this topic, depression and anxiety. We'll understand more about anxiety now with one story. Okay. So this story is about a 24-year-old girl, and I know her personally. Okay. So I have given her name as of now, Tanu. Okay. सो ये स्टोरी तनु के बारे में है एंड तनु एक हैप्पी गो लकी पर्सन है, उसे घूमना एंड घूमना फिरना, शी लव्स टू ट्रैवलिंग, उसे बाहर जाना बहुत अच्छा लगता है एंड लाइक मी तनु इज ऑल्सो फ्रॉम गुजरात। तो गुजरात से आसपास हमारे पास जाने के लिए कोई ज़्यादा जगह है नहीं, तो घूम फिर के हम एक ही जगह पे जाते हैं एंड दैट इज़ उदयपुर। सो वंस अपॉन अ टाइम इट हैपेंस दैट तनु अपनी भैया और भाभी के साथ उदयपुर गई हुई थी। Okay, and suddenly after 2 days she get a call that कि अभी आपको urgently घर आना पड़ेगा and she was all worried कि suddenly क्या हो गया, why do I have to go home now, and जब वो घर पहुंचती है तो she gets to know that her father has passed away and this leaves her into a big despair. She was not able to accept the fact that what is going on and why did all these things happen. However, it took a bit of time, but with the help of her friends and family, after a year and a half, she was able to manage her grief and she was able to accept this thing. However, हुआ ऐसा कि उसके बाद ये ट्रॉमा की वजह से उसको बार बार वरीज एंड एंजाइटी होने लगी। व्हाट हैपन दैट जब भी कोई बाहर जाता था उसको एक ही थॉट आता था, या फिर वो खुद बाहर जाने की सोचती भी थी दैट व्हाट इफ समथिंग हैपेंस टू माय फैमिली इफ आई गो आउट अगेन, या फिर वो अगर बाहर जा रहे हैं तो उन्हें कुछ हो जाएगा तो क्या होगा। She used to be in tension and worry all the time, thinking about all these negative thoughts which was keep on going on in her mind. So ये story थी तनु की। This was her story, she experienced it in a different way. Likewise, everybody experiences their thought and their anxiety in a different manner. I will hand it over to Amina now to understand more about what is anxiety. Amina, all to you. Amina?
Okay. Sorry, I was not able to unmute. Okay, so talking about what anxiety is. So as she told in her story, everybody experiences anxiety in a different way. But anxiety, understand what it is as an emotion. So anxiety is a feeling of worry, nervousness, or unease in situations in which an individual anticipates impending danger. So basically here what is happening is your brain is seeing some danger coming your way. So an individual is anticipating danger, and it's basically your brain's way of telling you that there's something going on, or there's something that a threat might be approaching towards your way, and you need to prepare yourself for it. So basically what happens is your brain's main task is to keep you alive. So the anxiety is a way of it keeping you motivated so that you do something about it. So basically anxiety motivates you to do something about a threat that is coming your way. And if you think about it like that, it's not a bad emotions. It actually helps you to prepare for something. For example, if we take the COVID situation, if we are not afraid of COVID, or if we are not even a little bit anxious about testing positive or COVID, we will not take the necessary precautions. So this anxiety is in a way keeping us motivated to take the necessary precautions, to maintain the distance, to wear the mask. So now you guys must be thinking that now if it is serving a purpose, why is it negative? Why is it bothering me? So the reason anxiety is associated with negative feelings is because it's a very unpleasant emotion to feel in the first place. And it's unpleasant because it needs to motivate you to do something. So there are two specific situations in which this healthy anxiety, as we can say, becomes unhealthy. So these two situations are number one, when you start feeling unsafe, or when you start feeling anxious about situations in which you are comparatively safe. For example, I'll give you an example from my work. If I have a colleague who has a appraisal waiting, let's say after 2 weeks he has an appraisal upcoming, and he's kind of scared of his boss for various reasons. So if he starts getting anxious for that appraisal, it's kind of unhealthy anxiety in a way because that situation is relatively safe for him. So he's feeling anxious about a situation which is relatively safe, in which there is no particular harm to him. The other condition in which the anxiety can get unhealthy is when it gets excessive. So, for example, let's take the COVID situation itself. I'm sure a lot of people must be worried to even check their phone. Like, what if I hear some bad news? What if a person near me has tested positive? Now, this kind of anxiety is very normal and natural reaction of our mind. But if it gets excessive to the point that it hampers your daily functioning, you're not able to do your day-to-day task, you're not able to maintain your relationships well, it starts interfering with your work, you're not able to concentrate there, then this is another situation in which your anxiety is kind of getting towards unhealthy. So the first situation which we talked about, in which you're comparatively safe and you're still getting scared of the threat that is coming to your way, is what we call hypothetical anxiety. So we call it hypothetical because our brain is perceiving a situation which is not technically threatful, but we are perceiving it to be a threat. Just as I gave the example of the appraisal coming up, for that for the person that situation is harmful, is threatening, but in reality, if you see that situation is not that harmful or not that threatful to the person itself. So now let's talk more about this. Let's understand how the vicious circle of anxiety works. I'm sure for anyone who is experiencing anxiety might feel that it's a vicious circle of thoughts, and it's very difficult to break out of it. So I just want to take a few minutes to help you understand how this cycle works. And for this, I'm going to take an example of a college going boy, and I'm going to name him Veer. Okay. So there is this college boy, let's say around 17, 18 years old, who has just started college. It's his first few weeks. He has met new people, and the teacher suddenly says that for your next assignment, everybody has to give a presentation to the class. And the boy himself is not very, let's say, fluent in English or not very confident in talking in front of a lot of people. So what happens, the vicious circle of anxiety starts, and it starts with the anxious thoughts. And if you notice your thoughts, whenever you have time, just sit and try to notice the pattern of your thinking. It will mainly be negative thoughts, and you will mainly be making predictions about the future. So the same is happening with Veer now. He's making negative predictions by having anxious thought, such as what if I fumble in front of a lot of people? They will judge me. I might lose friends before making anybody. They might think that I'm a fool. Or what if they think that I don't have any brains or I am not that smart? So these are all the predictions that he's making about the situations. And most of them are negative predictions. So now such kind of thoughts will have an impact on your body. So what will happen now? Your body will react to your thoughts. So his heartbeat will go fast. He might start sweating. For different individuals, this physiological responses are different. Like for me, I get a weird feeling in the pit of my stomach, and for some people, it's just excessive sweating. So all in all, it's a very unpleasant feeling, and it's kind of a discomfort. So your brain now gets a message that there's something going on with your body, which it's not liking. So it needs to do something about it. So what the first thing that will come to him is that to avoid the situations. So now he will do things in order to avoid the presentation. So he will either get into a fight with another classmate, or he'll injure himself in some way, or he'll just call up his teacher and say, I'm not well and I cannot do the presentation. So once he does that, what happens is he has now avoided the situation that he's afraid of. He does not have to give the presentation anymore. So now his brain is more relaxed and his physiological responses go down. It starts to calm down a bit and he starts feeling safe. So, this is the reason we call these behaviors safety behaviors, because it makes you feel safe. And your brain gets a message now that whatever I made my human do up till now, मतलब मैंने अभी तक इससे जो भी करवाया, जो एंग्जाइटी मैंने उसको दी, जो मैंने उसको अवॉइड करवाया प्रेजेंटेशन देना, इन सब से ये सेफ फील कर रहा है अब। सो मे बी आई शुड डू इट अगेन। सो नाउ जब भी उसके सामने ये अपॉर्चुनिटी आएगी प्रेजेंटेशन देने की, उसका ब्रेन उसको वापस एंग्शियस फील करवाएगा, और मे बी he might feel anxious in a more intense way now, because his brain thinks that this is what is keeping him safe. So this is how the pattern of anxiety works. So the next time he'll feel more anxious, he'll again avoid the situation, and again the cycle goes on and on. So as you can see in the diagram, there are three components to anxiety. One is your thoughts, the negative thoughts that you're getting, the negative predictions that you're making. The other one is the feelings that you're getting, the discomfort that you feel, the increase of heartbeat, the excessive sweating. And the third is the behavior, the thing that you do to avoid that situation, or the way you react to the situation. So now what can we do about it? So before I go ahead and explain to you what can be done about anxiety, I want to draw a basic difference between anxiety and fear, because these are the two emotions that are kind of confused a lot of time. तो fear और anxiety को आप cousins बोल सकते हो, because they are kind of related, but there is a different there's a specific distinction between them. So fear basically क्या होता है? Fear is when the threat has already presented in your environment. Okay, to put it in a very layman term, अगर मैं एक जंगल में हूँ और एक शेर आ गया है मेरे सामने, तो उस वक्त मेरी बॉडी का जो रिएक्शन है, द फाइट और फ्लाइट रिस्पॉन्स, उसको हम फियर बोलते हैं. Now, what is anxiety? Anxiety is if I'm in the same situation, if I'm in a jungle and I hear a sound somewhere, I'm predicting that that sound could be of a lion or a tiger, and that could present itself and could kill me. So these predictions that I'm making by hearing that sound is what we call anxiety. So in anxiety, the fear has not presented itself yet, but it may or may not occur. So now let's go on to understand what we can do about anxiety. So the first thing to remember is that avoiding situations fuel anxiety, especially in cases. Remember I told you about two cases. One is when it gets excessive, and one when the threat is not real. So when the threat is not real and you keep on avoiding the situation, आपके ब्रेन को कभी मौका नहीं मिलता ये समझने का कि वो सिचुएशन उतनी थ्रेटफुल नहीं है. सो इन द केस ऑफ वीर, जो मैंने समझाया पहले, अगर वो प्रेजेंटेशन अवॉइड करने की जगह प्रेजेंटेशन के लिए प्रिपेयर करके उसने प्रेजेंटेशन दे दिया होता, तो उसकी एंग्जाइटी नेक्स्ट टाइम कम हो गई होती, बिकॉज उसने देखा होता कि शायद सभी स्टूडेंट इतने डरे हुए हैं, या फिर टीचर इज नॉट दैट स्ट्रिक्ट विथ मी, एंड पीपल डोंट थिंक आई एम दैट स्टूपिड, दे एक्चुअली लाइक माई प्रेजेंटेशन. So basically, उसके anxious thought next time कम हो गए होते, because he has already faced the situation and his brain got a chance to realize that the situation is not that harmful. So that is one way to understand to avoid these anxious thought. The another way is to maintain a what if thought diary. Now the reason we ask you to write what if thought, I'll explain how thought diary works in detail later on. So, a thought diary is basically a diary in which you maintain a track of your thoughts. And we encourage you to write it in a way of what if thoughts, because what if gives you a space to understand that it's not a definite possibility, that it could happen and it could not happen. Both are the possibility here. So, if you just maintain a diary in which you write all the thoughts that you get when you're anxious, it will really help. I'll explain how it helps later on. So the next thing to do is to repeat, repeat, and repeat. The reason we ask you to keep on repeating is because, as I said before, mental health takes time, and it will take a lot of effort on your end and a time for your brain to rewire itself. So think of it this way, think of your brain as a computer. Okay, जैसे computers में wiring होते हैं, वैसे हमारी brains में भी wiring होते हैं. जैसे कंप्यूटर का एक पार्ट दूसरे से कनेक्टेड होता है, हमारे ब्रेन का भी पार्ट्स एक दूसरे से कनेक्टेड होते हैं. So to change the wiring, to change the connections, it takes a lot of time, practice, and efforts. And this is the brilliant part about human brain, that it can actually adapt itself to new environment. It can actually change its wiring. The only thing is that it takes time. So once you start practicing thought diary, once you start questioning your thoughts, it will take a few attempts, but eventually your brain will realize कि ये situation इतना डरने लायक नहीं है. So your anxiety might go down a little bit. Now let's go further and understand what thought diary actually is and what you can do at your end. So the first thing is to identify what is triggering your anxiety. So what is the situation in which your anxious thoughts are getting triggered? Once you identify that, just start writing all the thoughts that you're getting in your head. जो भी आपके दिमाग में आ रहा है, just try to put it down on pen and paper or on phone or on laptop, whichever one is comfortable to you. After you do that, you'll be able to see a pattern in your thoughts. And as I said, like for example of Veer, his pattern was mainly of judgment. He was afraid of judgment from other people. So that was his pattern. So the next thing you can do is question these thoughts. Question how possible they are. How what is the probability of them actually happening? You can question how real your threat is. Is it a perceived threat or is it a real threat? उस सिचुएशन में क्या आपको सही में हार्म है या फिर आपको लग रहा है कि आपको हार्म है? और अगर सही में हार्म है तो उसके होने के चांसेस क्या है, उसकी पॉसिबिलिटी क्या है? So there are a few ways in which you can manage your anxiety. Now this is the ideal way to do a thought diary. There are 5 different columns and there is a distinction between situation, thought, emotions, behavior and the alternate thought. However, it takes a lot of effort and time to reach from your automatic thought to a alternate thought. So I would advise you can take guidance from people. You can always go to our portal of SageAdvice. We have experts who will be able to help you how to understand and how to make this thought diary, and they'll even be able to help you guide you basically through the whole process. Another thing that I would like to mention here is that you cannot ever expect your anxiety to go away completely. It's your body's natural response to a situation. So you can manage your anxiety, but it will never completely go away. But you can always manage it to a point that it does not interfere with your mental health. It does not interfere with your relationship. So this was all about anxiety from my end. If you guys have any questions, you can always post it on the chat box and we will address it once we finish this webinar. Now we'll move on to depression. And I think before Himani talks about depression, we're going to show you a video clip. So for people who have seen this movie, they might know what it is. It is from a movie called Tamasha. For people who have not seen it, मैं थोड़ा हल्का सा एक brief दे देती हूँ कि क्या हो रहा है. So ये character रणबीर कपूर का is going through an internal struggle between who he is and who he wants to be. So इस क्लिप में हम उसके डेली रूटीन को देखेंगे एंड दिस विल गिव यू गाइस अ बेसिक ग्लिम्प ऑफ व्हाट डिप्रेशन कैन लुक लाइक. So we'll see the clip and then I'll talk more about it. You can just play.
Oh, Shahrukh Khan.
Please, please, please. Thank you so much.
Good morning.
Hey, morning.
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 Good morning, sir.
Good morning, sir. The seismic focus of the recent trade winds rests in the lateral shift of consumer behavior, which may appear bipolar, but it does not take an Einstein to correlate. Granted that we cannot un-Google ourselves from the geometrical growth of social media.
ओ हीरो, आज भी नहीं देगा क्या?
Good morning, sir.
Good morning, sir. I'd say global. Global yet local. This out-of-the-box strategy follows a bottom-upward approach, yet has a 360 perspective.
So, how was your spa treatment, sir?
Good, could be better.
Amina? Amna, over to you. Amna, are you there? Fiona, can you help me to unmute Amna?
Yes, thank you. Sorry again for this disturbance. Okay, so as you could see in the video, it might seem like a video of a normal day-to-day routine. However, I don't want you guys to confuse monotony and boredom with depression. What the thing that was to be focused over here was the complete lack of pleasure that he felt during his entire day-to-day, and the internal struggle that he was going through. So, for those people who have seen the movie, will know that there is another scene that comes up later on in which he has a complete outburst in which he just shouts at his boss. And this thing that he is going through eventually affects his work life, his relationship with Deepika, and his relationship with himself also. So, this is the thing that we wanted to focus on when we wanted to show this clip. I'll give it over to Himani now, who will explain in detail about what depression is and what are the signs and symptoms of it. Over to you, Himani.
Okay, thank you so much, Amna. Okay, so we'll understand what exactly depression is. But before that, let's understand that what is the difference between sadness and depression, because we keep on getting confused, right? That whether I'm sad or whether I'm depressed or, what exactly it is. So first, let us understand that what is the difference. So sadness is a natural emotional reaction to the life event, wherein depression is a mental illness. फॉर एग्जाम्पल अगर हम खाना खाने बैठे हैं, ठीक है, एंड वी आर यूजिंग अ पेपर टू पुट इट ऑन आवर सैलड, एंड बाय एनी चांस अगर वो हमारे नाक में चला जाता है, ठीक है, तो क्या होगा? either we'll sneeze or we'll cough, right? But does that mean that we have a cold? No, right? It's just a natural reaction of pepper to go into a nose. Just like that, sadness is a natural emotional reaction to any life event. Like if you have, for example, if you have lost a job, in those moments, it's very simple to, a natural reaction to feel sad about it. However, just because you are sad about something, that does not mean you are depressed. Like as I've said, just because you're sneezing and coughing because of the pepper going in your nose does not mean that you have a cold, right? That's why depression is a serious mental illness, wherein sadness is a natural emotional reaction to life events. Sadness is very brief, wherein depression is persistent. As we can see that, right, that sadness has a particular reason to come in. It comes and then it goes away. It fades away by itself. However, depression, it can stay, the episode of depression can stay for a week, for a month, or for years if it has been left untreated. That's why sadness is brief. It comes and it fades away by its own, wherein it's not in the same case with the depression. Sadness is very specific and depression is very vague. As I have said, right, that sadness comes with a specific reason. जैसे कि आज फॉर एग्जाम्पल मेरी कोई दोस्त का ब्रेकअप हो गया है, तो शी इज ऑफ कोर्स गोइंग टू बी फील सैड. Where in depression, the people who are going through depression, sometimes they are not aware about that. Why are they feeling this way? And why are all these thoughts coming on in their mind? So that's why sadness comes with a specific reasons, wherein depression is very vague. Sadness has a short-term effects and depression has a long-term effects. As I said that, sadness comes and it fades away by itself. Wherein depression, if it's left untreated, it stays for a longer period of time. Now let's understand what depression is. So this is according to a definition given by American Psychological Association that depression is a mood disorder characterized by persistent negative feelings and change in one's thoughts and behavior. It can vary from three different levels: mild, moderate, and severe. Okay. I'm again repeating, as we said ahead also, kindly do not label yourself. If you feel that, if you have any such signs, which is right now there on the screen, uh, you know, minimum of 2 to 3 signs, it has to be persistently there for 3 to 4 weeks. If you think that you have this thing, or your relatives or your friends or your family has it, do not diagnose it by yourself. Do not label yourself or even to your friends. Please go to professional. As Amana added that you can always go to a portal of SageAdvice where they have 40 plus experts who are certified counselors. You can always go there and get yourself checked and ask them whatever issues you have. So before we understand sign of depression, I'll tell you a small little story. Okay. So again, I know this person very closely, and her name is Anjali. Okay. So Anjali is 25-year-old right now, and हम दोनों साथ में college में पढ़ते थे. ठीक है? Before 2 years. So we were in a good contact at that time, of course, because एक साथ एक college में थे and all. So college खत्म हो गया. We were not in that much of contact. And when this pandemic started, we were just texting each other to check on, each other and their families. That sab theek to hai na? Is everybody fine in the family? And I asked her that, I got to know that ki tujhe job mila tha in a very reputed MNC. So Anjali was working in a very reputed MNC in Ahmedabad, and she was earning also really good. So I asked her that, how's it going? It has been a year of your job. So she's like, the job is really good. My designation is really good, but somehow I'm just not enjoying it these days. Like, पता नहीं कुछ मजा नहीं आता है इतना. Like, अगर मैं सुबह उठती हूँ जैसे ही बेड में से, and after an hour or two I have to join my job, but I just don't feel like I have any energy in my body. या फिर कुछ भी मजा नहीं आता है. मुझे पूरा टाइम थकान सी महसूस होती है. And she used to love dancing, to adding on to that, but she mentioned that अब उसे डांस करना भी अच्छा नहीं लगता है. So this was a story of Anjali, and she felt this thing in a very different way. So let's understand more about which are the signs of depression. Lack of concentration. So if we understand lack of concentration in the case of Anjali, she even added while she was telling me that उसको जब भी कॉलेज का कुछ प्रोजेक्ट दिया जाता था, she told me that मेरा ध्यान ही नहीं लगता है. Even though it was such a simple project, she was like, I was not able to concentrate. So lack of concentration is one of the sign of depression. Another sign is that feeling low, crying, or anger outbursts. It differs from people to people. Different people can feel different signs. Like some people feel very low about it. Some people feel like, just crying about it. Or some people have anger outbursts where they just keep on either speaking about something, or, they're just angry and removing all that anger out. Recurrent thoughts of death. Suicidal deaths are also one of the signs, wherein it's not there in every case. However, it's a part of one of the sign of depression. Significant distress and impairment in social, occupational, or any other important areas of life. In case of Anjali, her occupational life was getting affected. That वो focus नहीं कर पा रही थी अपने काम में, और interpersonal relationship with her colleagues were also getting affected, as वो किसी से भी ठीक से बात नहीं कर रही थी, and वो properly coordinate नहीं कर पा रही थी. So this is how it was affecting in her case. Lack of interest, as she mentioned that even though the work she was doing, she actually liked doing it, but while she was going through it, she actually lacked interest in that. Even in dancing, she loved to dance like in the earlier time. However, while she was going through this time, she mentioned that usko dance bhi karna acha nahi lagta hai. So this is one of the signs. Feeling fatigue or loss of energy, even though you have just woke up from the bed and you have not had any physical exercises, you still feel fatigue or loss of energy. Sleep disturbance and change in appetite. These are two signs which which affects a lot of people. That either some people sleep a lot or eat a lot, while some people are not able to sleep for particular hours, and they don't even starve or they don't even feel like eating anything. So this is how these two signs affect. Another last sign of depression is that feeling of worthlessness, hopelessness, and helplessness. People who are going through depression can feel like that whatever they are doing in life, they just feel that there is no worth of it. Like in case of Anjali, she was feeling that even though she had a really good job, really good pay, she was having a good time with her family as well. However, she was feeling that all this is just worthless, कुछ भी काम का नहीं है. So these are the few signs of depression which are mentioned here. However, there are few more too. I would again like to add that if you have minimum of 2 to 3 signs for persistently 3 to 4 weeks, then only you might can call yourself, or you can always go and get yourself talked with a professional. Okay, so we understood what is the difference between sadness and depression. We understood what depression is. Now let's understand what are the myths about depression, which is keep on going on in the market these days. That a lot of people say that okay, ऐसा है तो depression है, या फिर depression में तो ऐसा ही होता है. So first myth about depression is that depression is only brought by a traumatic event. A lot of people say that, right? But no, it's not the same. As we have heard the story of Anjali. In her case, there was no traumatic event which was happened even in the past or during that particular time. She was still feeling all these signs where I just mentioned. So it's a big myth that depression can only be brought by a traumatic event. It's very vague. It does not need to have a particular event to occur in your life. Another myth about depression is that everyone experiences depression in same way. No, that is wrong. Like how we are grown up, like if we have siblings, right? We are grown up in the same family, same culture, and we have got same love from our parents. We still have a different thought process, right? Same goes with like every human being, that because of their different experiences, they feel depression in a very different way. So it's not necessary that everybody feels depression in same way. Another and a very important myth about depression is that people say that depression is weakness. No. All of you must have heard about these two very famous cases, right? Two very famous celebrities who came out and talked about their depression and the therapy. Deepika Padukone and Honey Singh, right? We all are aware about the success which they have achieved in their industry, and whatever they have gained in their life, personal life as well as professional life. Everybody is aware about it, right? Were they weak people? No, right? So it's not necessary that depression can only occur to a weak people, or if it's happening to you, it's a weakness. No, that is not true. Another last myth about depression is that medication can only way to manage depression. No, that is not true. However, medication with the help of psychotherapy together becoming facilitators for each other can work as a therapy, or can work as a proper treatment for depression. Alone medication won't work for depression. Therapy is must. Okay, that does not mean that medication is not necessary. In certain cases, if your doctors prescribe it, you have to take it, but with the therapy. Okay, now we all understood that what depression is, what anxiety is. All of you must be thinking, right, कि हाँ ये सब तो ठीक है, पर यहाँ तक हम ना पहुंचे या फिर हमको ये सब ना हो या फिर हम every day में how can we keep ourselves how can we keep our mental health into a proper well-being state. So these are some few tips and techniques and takeaways for today's webinar. That stop pressurizing yourself to be perfect, either to yourself or to people around you. We have a lot of things like that कि हमें सब कुछ आना चाहिए. We have to know each and everything. No, that is not necessary. You must be good in something. Some other people are good in some other things. So we don't have to keep on pressurizing ourselves to be perfect in each and everything. Accept yourself however you are. Another technique here is that you cannot control everything. Right now, whatever is going on outside about the pandemic and COVID, right? Is it in our control? Like, can you just go and stop people who are not wearing masks to get out of their house? No. What we can do is that if we are getting out of our house, we can wear a mask. We cannot control other people or whatever is going on around us. So stop having the feel that I can control everything. Another thing is that especially in today's era, whatever is going on, please be well informed. Do not accept or do not believe in every news which you are getting. Be well informed. How will you respond to COVID-19? Don't stay in denial. If it by any chance if it has happened to you or your friends or your relatives, just accept it. Don't panic about it. Keep your plan ready from the prior. So these are the things, a few things which we can do. Apart from this, exercise. All of you must have heard, right? Since this pandemic has started, a lot of people have started doing cycling and going to studios, gyms for physical exercises. It's really, really important to do a physical exercise. Yes, it has an impact on mental health. A lot of researches have proven that there is less chances of that person to go through mental health issues if you are regularly doing your physical exercises. So exercises is one thing. Sleep cycles. I'll tell you a small story that why sleep cycle is very important. आप सबने सुना होगा, right? Especially those who are here, like the children that our mom keep on telling us that सुबह जल्दी उठ जा सारे problems solve हो जाएंगे, रात को time पे सो जा सारे problems solve हो जाएंगे. We keep on hearing all these things, right? So I'll tell you a small story that why sleep cycle is very important. So there is this person in the library. Okay, he's a librarian. And all of us must have been to library once or twice. Okay, so जब for example अगर library 7 बजे बंद हो जाने वाली है तो लोग क्या करते हैं? They leave by 6:45 or 7 o'clock, right? And some of them keep the books at its places, or some of them just leaves it at its desk, however it is. So what happens is that once the library is closed at 7 o'clock, okay, librarian will take all the books and see कि कौन सी book कहाँ रखनी है. For example, history की book है, okay, there is a history department. Science की book है, science का department. Comic book है, comic department. And this is how we keep. This is how the librarian will keep every book into a different departments, right? जब भी हम सोने जाते हैं, our brain works in the exact same manner. Whatever thoughts we have had, whatever experiences we have had in the whole day, or even whatever memories we have, once we go to sleep, our brain will start putting everything into a proper places. If you want to understand more about how our emotions work, there is an animation representation of the emotions via movie called Inside Out. I will repeat, Inside Out. It's an animated movie. If you have not watched it yet, please watch it. It's a very interesting movie for everybody. It's not for the kids only. It's for everybody. Anybody can watch it. So once you start sleeping at 11 o'clock, your brain will get a message that, okay, the human has slept. I'll have to start arranging everything, whatever I have. So sleeping on proper time and waking up on proper time is very important because our brain keeps on giving messages so that it goes on a right direction. Okay, meditation. One myth about meditation I would like to clear here, that a lot of people must have heard that whenever you start doing meditation, कोई भी थॉट नहीं आना चाहिए दिमाग में, बस अगर आप ओमकार कर रहे हो या फिर जो भी म्यूजिक सुन रहे हो वही आपके दिमाग में चलना चाहिए. नो, इट्स नॉट ट्रू. If you are doing a meditation, that means you are trying to concentrate. If you are trying to concentrate, whatever the thoughts are coming, let it come, and then it will go as well. Okay. Nutritious food is equally important, as all of us must have heard about it, that it's, with exercise, with sleep cycle, food is equally important for our well-being. And another last technique for everyday well-being is hobbies. Find one hobby for yourself, or if you already have, if, for example, if today you're feeling low or you are too angry about, आज कॉलेज में कोई असाइनमेंट अच्छे से नहीं किया है, या फिर इफ यू आर अ पेरेंट, आज घर पे बहुत सारा बच्चों ने परेशान कर दिया है, या फिर इफ यू आर अ वर्किंग प्रोफेशनल, शायद आज कोई प्रोजेक्ट ठीक से आपका नहीं हुआ है, एंड you are basically tensed or not in a good mood. Make sure that you have one particular hobby for yourself which you love to do, and try doing that in that time, which will which will enhance your mood, or it will at least try to enhance your mood during that particular time. Now, these are few tips and techniques for COVID well-being. If anybody around you has tested COVID positive, how we can deal with them. First of all, choose kindness. Don't stigmatize those people by, once, even though they have tested negative, we don't have to go near to them, don't talk to them, don't go near to their houses. No, be kind to them, ask them if they need anything. Be virtually there, because of course, unlike other diseases, in COVID we cannot just be there present with that particular person. So what we can do is that we can virtually be there for them, right? We can take care of we can emotionally take care of them, call them, do a video call and ask them, how are you doing, are you doing fine? Have a mental health check of the person around you. And the last thing is that, just to have a distraction and to have a little bit of fun during their isolation time, play some games with them. It will at least lighten up their mood and distract their mind from having all the thoughts and whatever they are going through during that time. Now, this was all about the everyday well-being. Now, for example, if there is some emergency, by emergency, what I mean is that there is a tons of emotions which is going on. If you are too overwhelmed with the emotion, what can you do? First thing to do is that focus on your breathing. All of you must have heard, right? कि सब लोग बोलते हैं breathing पे focus करो, breathing पे focus करो. But हम क्या करते हैं? No, we do not have to do this. When I say focus on your breathing, what you have to do is that make sure you close your eyes, take a breath from your stomach, inhale, hold, and exhale. I will show you how to do it, okay? Start repeating the same process for 3 times whenever you are, whenever you are into a situation where you are having a lot of thoughts which is coming on, you are not able to, manage it. Focus on your breathing by taking a breath from the stomach. Another technique which you can use in the emergency times is your relax your muscle. If your physical body will be relaxed, your mental your mental body will also start getting calmed down in that particular moment. Now, how can you relax your muscles? What can you do? If you have, like, start doing your wrist with, clockwise, anti-clockwise, with your head also go down, up, left, right, clockwise, anti-clockwise. While doing this, make sure that you are also focusing on your breathing pattern as well. So this is something which you can do in your emergency time when you are having a lot of emotions and you're not able to manage it. Now, let's understand that when do we need to seek professional help? Amina, can you help us to understand that?
Sure, let me just take a deep breath first. Okay, that helps. Okay, so I think you all must be thinking now that having all this information, I still don't know when I should go for professional help. Like, do I need to go right now? Should I wait till the symptoms get heightened, or what? So there are three conditions in which you absolutely must seek professional help. One is when it gets excessive and it gets out of your control. So when the thoughts and all are so or overwhelming that it starts affecting your relationship with yourself, your relationship with people around you, and it gets out of your control. That means even if you're trying to distract yourself, you're still not able to distract yourself. This is when one sign that you should seek professional help. Another sign is when it starts interfering with your work life or your relationship around people with you. So when you're not able to concentrate on the projects that are being given to you. ऑफिस पे जब कोई कुछ भी बोलता है तो you just get angry at them, या फिर घर पे किसी ने थोड़ा कुछ इधर उधर बोल दिया एंड आप उनसे भी झगड़ा कर लेते हो. तो जब बार बार ये आउटबर्स्ट होता है तो क्या होता है, इट स्टार्ट्स इंटरफेयरिंग विथ योर रिलेशनशिप, इट स्टार्ट्स इंटरफेयरिंग विथ योर वर्क. So this is another sign that you might need professional help, कि कुछ हो रहा है अंदर ऐसा जो शायद आपको समझ में नहीं आ रहा है, जो शायद एक third person might be able to help you better. And the third condition is when whatever is going on is not related to any particular event. For example, if someone close to me has passed away or has tested positive, and I feel very anxious and I'm not able to concentrate at work for a few days, that is understandable. That is a natural reaction. But if there is nothing going on around me, there is no particular trigger that is around me, and yet I feel unfocused, I feel confused, और मुझे फिर भी बहुत गुस्सा आ रहा है, इरिटेशन हो रही है, एंग्जाइटी हो रही है, और उसका कोई रीजन नहीं दिख रहा है, that is another indication that there's something going on deep inside you which might need recognition. You might need to be aware of what is going on, and a counselor can help you. So if you want to know where you can go to seek help, as Himani stated previously, you can go to Sage Advice portal. You just need to log in. You just have to log in with your Gmail. So it's, you can just say that help is just a few minutes away. It hardly takes 10 minutes. But I also want to urge here that you do not have to wait for these moments to come. You don't have to wait for these red flags to come. Even if you feel that you're going through something which other people around you समझ नहीं पा रहे आपको, या फिर आपको लग रहा है कि आप अकेले हो, अभी ऐसा पॉइंट आया नहीं है बट आपको जस्ट एक थोड़ा अकेलापन महसूस हो रहा है, these are also the few moments in which you can go and seek help. अगर मुझे ऐसा चाहिए कि I want to grow as a person, like I know who I am, but I know I have more potential in me and I want to grow as a person. That also is a good indication for you to go for counseling, because a counselor might help you to get there as well, to achieve your goals, to be basically a better functioning individual overall. So you don't have to wait till the last point to seek help. The last slide from us is like, how do you help somebody who is facing mental health issues? So अभी ऐसा time है जहाँ पे everybody is suffering in one way or the other, and you might not be going through anxiety, you might be able to manage yourself, but what if your mom is not able to manage herself, or what if your sibling is going through something, उसके friend को positive आया and she is feeling anxious? So what you can do in such situation? How can you help a relative or a friend? So the thing that you can do at your end is, when you talk to them, try to maintain a neutral and supportive language. Try not to put a lot of judgment in your language. Like ऐसा मत बोलो कि ठीक है हो जाएगा, सब ठीक हो जाएगा, तो क्यों इतना टेंशन लेता है, या फिर इसमें रोने की क्या बात है, इसमें टेंशन क्यों ले रहा है. So such things kind of minimizes their anxiety. उनको लगता है कि उनकी anxiety इतनी important नहीं है, उनका problem इतना important नहीं है. That doesn't make the other person feel so good. तो ट्राई टू मेंटेन कि आपकी जो लैंग्वेज है वो बहुत ही न्यूट्रल है और सपोर्टिव है. देन लिसन केयरफुली टू व्हाट दे शेयर टू यू, क्योंकि बहुत करेज लगता है कभी कभी लोगों को टू ओपन अप. सो इफ दे आर शेयरिंग विथ यू, यू माइट बी एन इम्पोर्टेंट पर्सन टू देम. So don't be distracted on your phone, or don't try to change the topic again and again because you are uncomfortable. Just give them, lend a ear to them, listen to them carefully about what they have to say. Another thing that you can do is provide a non-judgmental space. Provide a space in which there is no judgment coming from your end. उनको ऐसा नहीं महसूस होना चाहिए कि आप उनको जज कर रहे हो, उनको अपने से कम समझ रहे हो, या उनको वीक समझ रहे हो. So ऐसे words और ऐसे language avoid करना try करो. Try to make them feel safe. Tell them it's okay to feel this way and it's understandable and that people do go through all these things. Then you can encourage them to seek professional support. You don't have to push them. You cannot. Can't force a person to go to a counselor. And even if you do, it will not help. All you can do is you can encourage them. You can tell them, okay, what you're going through is, I understand it must be very difficult for you to manage all these things. So why don't you try and go to a professional who can help you out? I am not equipped to handle you at this moment. Maybe somebody else will be better than me to help you out. So these are the few suggestions. These are the few ways जिससे आप उनको समझा सकते हो. You know, they need a professional help and they can go and it's okay. Don't try to diagnose or label their emotions. There are professionals who do that. So we don't need to do that to ourselves or others. So don't put any labels as depression or anxiety disorder or OCD. OCD हम बहुत use करते हैं. कोई थोड़ा भी साफ सफाई करे तो ये like you have a OCD. So don't do all that. We have professionals to do. And the last thing to keep in mind is to share, to let them, allow them to share as much and as little as they want. Don't keep on bombarding them with questions. Like after this PPT, you might have a few questions ready in your mind. So कोई आ रहा है आपके पास बोल रहा है कि मुझे एंजाइटी हो रही है तो मत पूछो कि थॉट क्या है, तेरा क्या थॉट है, कौन सी सिचुएशन से हो रही है, क्या इमोशंस हो रहे हैं. Don't bombard them with questions. Let them share as much or as little as they want at their own pace. So the last thing that I would like to conclude by saying is, in our country, mental health is a stigma, and I think आजकल लोग वो stigma जा रहा है बहुत धीरे धीरे. But लोग अभी भी बहुत resistant है to go to a counselor. So the simple thing to keep here in mind is जैसे अगर हाथ पे लग जाती है, अगर हाथ टूट जाता है, suppose कहीं पे चोट लग गई, ठीक है, अगर एक दो दिन में वो ठीक नहीं हुआ अपने आप, तो आप डॉक्टर के पास जाते हो, राइट, क्योंकि जरूरी है, वरना वो हील कैसे होगा. सिमिलरली अगर आपके माइंड में कुछ हो रहा है, इफ देयर इज सम इमोशनल प्रॉब्लम दैट यू आर गोइंग थ्रू, अगर वो 2-3 दिन में अपने आप ठीक नहीं हो रहा, दैट मीन्स दैट यू माइट नीड एन आउटसाइड हेल्प, वरना वो हील कैसे होगा. आई थिंक इट वर्क्स द सेम वे. एंड ओवर टू यू हिमानी, वुड यू लाइक टू ऐड समथिंग?
Yes, thank you so much, Amina, for letting us know about all these details that what we can do. Before I give it to Shehnaz ma'am, I would just like to tell one thing that, we have heard all these things that जब भी कुछ होता है बहुत confusion होता है कि किसके पास जाने का, साइकेट्रिस्ट के पास जाने का, साइकोलॉजिस्ट के पास जाते हैं, ये लोग होते कौन है, डिफरेंस क्या है इन लोग के बीच में. So I'll just explain you in a very brief that psychiatrists are medically certified doctors who have finished their MBBS degree and after that specialization if they have done. So they can prescribe medicines, wherein psychologists are certified therapists, whether they have done their MA in psychology or MSc in psychology. Those are professional counselors, professional therapists who cannot prescribe medicine. So there's a main difference between psychiatrists and psychologists. So by any chance, if you have any issue, know that whom do you have to go to. That is it from my end. I'll give it over to Shehnaz ma'am. Thank you.
Thank you very, very much, Amina and Himani, for a wonderfully comprehensive and a lucid presentation. Before we go a little ahead, I would like all of you to please give your feedback to this webinar. There will be a form put up at the end of this webinar. Please fill it up and give us your valuable feedback so that we know how to improve ourselves even as we go further. And we are ready to roll out with questions. So whoever has any questions or any queries, either you can unmute and ask us directly, or you can put it up in the chat box and we will answer you. As I wait for you all to collect your thoughts and absorb all the information and the explanation that Himani and Amina have given to you, let me look at some of the queries in the chat box where somebody has mentioned that that person is COVID positive 15 days ago and now suffering from anxiety. this is obviously a natural reaction to testing positive for COVID. With all the negative news and all the news overload that we have, anxiety when you get COVID is a natural reaction. But if you could, put into practice some of the tips of day-to-day living, the positive living, the exercise part of it that Himani and Amina spoke about, the thought diary, diverting your mind, hobbies, I'm sure it will help you cope with this social isolation and the quarantine that you're going through. And I hope you make a complete and a speedy recovery. Another query is that what if people think that I'm anxious, but what I think is I'm not? The point being that if you feel you're not anxious, which is good, maybe you need to stop for a moment, gather your thoughts, as Amina had mentioned. Look out at the pattern of your thoughts. Are most of your thoughts negative? How do you react to those thoughts? What is your reaction? And are you able to cope with those situations that you face? If you realize that most of your reactions or your stressors are more than your coping mechanisms, again, I would suggest that some of the tips that Himani and Amina have shared today, try and practice those. And if yet the coping mechanisms fall short of the stressors, please seek professional help. Are there any other questions that?
I think we had one question. They were asking whom should we go to? When do we know when to go to a psychiatrist and when to go to a psychologist?
Yes, as Amina mentioned, that a psychologist is a mental health professional who's done their masters, whereas a psychiatrist is a doctor who will essentially prescribe medication. So when you feel that you are suffering from a certain symptoms, or you are unsure whether you're actually suffering from them or is it something else, it makes sense to see a psychologist first. Even as they said that you want to just grow as a person. There is no issue as such, but you would like to be a better version of yourself. Seek a psychologist first. The psychologists have all of us as psychologists have our own tools to assess and take a decision on whether you need a psychiatrist, whether you need medication or not. And then the next step could be see a psychiatrist. So therapy is definitely very important.
Okay, we have another one. They're asking, we at the time of sleeping, we get negative thoughts. So how to cope up with that?
One very good exercise. So this is what we call the sleep hygiene. Have a routine for yourself. Maybe a little glass of warm milk, maybe a warm shower, and a small little exercise before you go to bed every day. Think of 5 things that you are grateful for in life. When you focus on gratitude, those 5 things can be as simple as I'm thankful that I'm alive today, or I'm thankful for the food I've had, or I'm thankful that I interacted with my friends. It could be anything. But when you focus on gratitude, you are helping your brain rewire from negative thoughts to positive thoughts. Make sure the atmosphere in the place where you sleep, your bed is comfortable. The temperature in the room is comfortable. It's neither too hot nor too cold, right? And as you lie down.
Sorry, ma'am. Sorry to cut you.
As you lie down, you can focus in your mind's eye, on a particular happy picture, maybe of a scenery or a memory that you have, or you may chant a name or a word, until even chanting something as simple as I will sleep naturally and peacefully. I will fall asleep naturally, automatically and peacefully. Also could help. Yes, Imani.
So she had also, yeah, so she had also mentioned that that's the first thought she gets even when she wakes up. So I just want to add to what ma'am said, that if these thoughts are recurrent throughout your day, and if it has the same theme, the same component, then you might want to look into it regarding what they are by the help of thought diary, as ma'am mentioned. And if they still don't go away, if they still don't help, then maybe seek professional help.
If these recurrent thoughts are what we call intrusive, they keep bothering you through the day in everything that you do, and you can't focus on anything but these thoughts, is the time to seek help, professional help. So we very easily, go to a physician when we have ailments. Suppose we have a stomach ache or a cold or a flu is not something that I would like to mention right now in the pandemic times, because it might create more anxiety. But yes, something as simple as a fever or a stomach ailment or a skin problem, we don't think twice to go to a doctor. निकल पड़ते हैं दवाई लेने के लिए. So why do we hesitate so much to seek help for our mental health, which also impacts our physical health? It should be as simple as going to a physician. As very rightly put in the presentation, seeking help is not a sign of weakness. On the contrary, it's a sign of courage. It's a sign of awareness. Yeah? So I would definitely appeal to each and every one of you that please do not neglect your mental health. और मेरी नानी हमेशा बोलती थी कि health is wealth, and which is very true. But when we talk of health, it has to be mental as well as physical. And before we sign off this webinar, is Anuradha Rajan there in the webinar? Can you please switch on your video, Anuradha?
Yes, I'm here.